Good evening. My name is Seth Rubenstein, and I am president of the American Podiatric Medical Association. It's my pleasure to welcome you to tonight's webinar. Tonight's presentation will focus on employee issues during the time of COVID-19. This webinar is part of the APMA's resources to help members during this unprecedented time. You can access more APMA resources at www.apma.org/COVID-19. A few housekeeping notes before we get started. This webinar is being recorded and can be viewed again on the APMA website. This presentation is for informational purposes only, and it should not be construed as APMA rendering legal advice or setting a standard of care or national guidelines. For legal advice, we recommend speaking with an attorney licensed in your jurisdiction. Tonight's presentation will last approximately 40 minutes, followed by 5 minutes for Q&A. If you have questions, please type them into the GoToWebinar toolbar on the side of your screen. Unfortunately, we will not be able to get to every question tonight. Now, it is my pleasure to introduce our speakers. Paul Monsees is a partner and litigation lawyer with the law firm of Foley Lardner. Paul is the chair of the firm's litigation practice in Washington, D.C., and he represents and counsels employers in a broad array of employment issues. We'll also hear from Taylor Weil, senior counsel at Foley Lardner's Dallas office. Taylor represents employers in litigation and transactions, as well as policymaking involving difficult labor and employment issues. It's now my pleasure to turn the webinar over to Paul and Taylor.
Thank you very much, Dr. Rubenstein, and welcome everyone. We know you're busy practitioners, so thank you for taking some time this evening. As Dr. Rubenstein said, Seth, Taylor and I have spent our careers guiding employers through sort of thorny issues, so hopefully we can add some value to tonight and answer some of your questions and present some issues for thought as you either about to reopen or if you've already reopened to try to make that as smooth as possible. You know, keeping in mind you're trying to balance a number of individual and collective issues, right? You have your employees who have concerns about safety and health. You know, the infection rates, we all now see that states are opening up. So you have concerns about activities going on that maybe people haven't been introduced to in the last 2 months if they've been staying at home. You have your practices to get back together. You have patient procedures that have been delayed and need to be scheduled. And we're aware of, you know, those pressures. You have the overlay of federal guidance, including from the CDC. You have states that are doing things at different phases and paces. You have local guidance as well. So we know there's a lot out there. So we'll try to cover a couple of issues that we in our practice see, you know, quite frequently among our clients. I'd say the main, you know, takeaway for today is that there's no one specific, you know, plan or blueprint that make this all work and be successful. Obviously, it's different based on where your state is, how large your practice is, and individual circumstances for your practice. So we're going to cover three main things: getting back to work, as you see there. Then Taylor's going to talk about some disability issues. There are the Equal Employment Opportunity Commission and the American with Disabilities Act applies to certain employers of a certain size. And then each state has its own disability statute, which may apply as well to even employees of smaller size. So that's more likely to affect your practices. And then there are leave issues. So we're going to talk about some of the leave statutes that have come into play and in the COVID you know, time that we're in. So next slide, Chad, please. So getting back to work, if you go to the next one, we're going to talk about having a plan to reopen and we're recommending that people have a written plan that will encompass a couple of different important components. And obviously, as we've said, one of the main goals is to create a safe workplace. Obviously, that affects employee morale, You want them to have confidence that their employer is looking out for their health and their best interests. You're obviously introducing patients, so you have visitors, guests, other family members may be coming into the office, so you have the public coming into your employee workspace, maybe more than some other employers do. So you have those issues to be concerned about. And then we'll talk a little bit about temperature testing towards the end of this first section. Next slide. So in planning to reopen, we really do emphasize having a written plan, even if you're a small employer, and to have a number of these components covered. Now, you're not typically going to be large enough to have an individual person with all these responsibilities. Your practices may be 15 people, 20, a little bit less. But each of these components, someone should have responsibility, obviously, to make sure that the plan is being executed. But the logistics can be a significant issue, the logistics and structural issues. And by that, we mean, how are your employees and patients, how are they getting to your practice? Are you on the main level? Do you have access directly to the parking lot, for example? Do people need to come through a main lobby, go up an elevator, go past other places of business to the suite where your practice is? So what is the actual arrival and departure process going to be in your practice for both your employees and your patients? I mention employee travel here because we'll have, employees will be maybe going away on the weekend as things open up. What are you going to do about, if they're going to the Lake of the Ozarks, and we just saw last week how much people were not following the social distancing rules? What will you do when people come back from a weekend or from a week away, and what questions will you ask to make sure that, as much as you can, where they've been, have they been to an area which is a hotspot, for example? So those are what we have in the logistics category. Structural is really more or less coordinating with the landlord or the owner of your building to the extent they have procedures that should be consistent with yours, or at least you should know what theirs are. Disinfection is obviously critical for the CDC and all the other guidance that we see. So you will want to make sure that someone is not only responsible for making sure that your area gets cleaned and disinfected, how often it gets done, make sure you have the supplies to do it, and to coordinate with, if you most likely have a cleaning service, what are they doing? Are there people wearing PPE when they come through your suite? What screening procedures do they have for their people, for example? On the feedback point, it's really just to make sure employees buy in, that they feel like they can have input, and to ask their feedback if the program plan is working, if there should be tweaks and so forth. And then training, obviously, there's a lot of regulatory guidance. It changes from time to time. The CDC issues guidance quite regularly now, as does other agencies, including your states. So staying on top of that is important. And let me just make a note here. We're talking primarily about employment issues here, but obviously you have the issue of liability from exposure, either from your employees or from the visitors in your suite. So having this plan will be an important tool to have if there is a claim, to show that you did have a plan in place, you did have the critical components that the CDC advises that you have. So that will be an important thing to be able to demonstrate that you acted reasonably. And another note I'll say, just for all of you, it's a good practice for you to contact your insurance broker, because they will, obviously they're writing the coverage that would apply if there were any claims like this. And you will want to get information from them about if the carrier has certain best practices that they recommend for medical practices, so that you incorporate what their guidance is, since they ultimately will answer for a claim, into any plan that you put together. Next slide, Chad. And this is just more about some of the questions you should think about. And really, it's the second bullet that's the most important. What is the particular risk profile that your practice has, whether it's your physical location, your office layout, how often do you have deliveries coming in? Do you have common areas in your office where employees congregate? How do you treat those? Where are your patients coming from? How many patients will you have at any one time? So all of those factors go into what the unique risk that your practice and your physical layout might present. So in addition to that, when should you reopen? Obviously, some of that is based on state and local guidance. What and how, what sources of COVID might they be exposed to? Some of that gets to travel issues that we just talked about. Do you have a contingency plan? And by that we mean, if you have people that your staff become sick, what are your options for replacing them on a temporary basis? Do you have a staffing agency that you use? And if you do, you should be aware of what plans and procedures they have in place, similar to what we've been talking about here. Can you make physical changes to the workplace? And we'll talk about that a little bit more in a minute, as well as administrative actions like staggering your work hours, staggering your patient visits, just to minimize traffic and minimize, potential exposure. Next slide, please. And here's a phased reopening, which again is more going to be driven by your state most likely, but you will also be, I am sure, phasing in by these staffing issues and patients that we just talked about a moment ago. There may be, you may have been doing telework. If it has been successful, you obviously can continue with that to try to limit and minimize the number of people that are coming through the space at any one time. Obviously, you'll have to enforce the social distancing that is quite prevalent these days and has become somewhat controversial in terms of whether people are following it. But again, do you close areas where people congregate? You should close your office at a sufficient time so that it is to be cleaned and disinfected overnight. So again, coordinate with your office cleaning service so that you know exactly how long it will take them, because they will be using more procedures to clean an individual space than they were before. It's going to take more time. Next slide, please. Obviously, sanitizing, disinfecting is a huge thing with the CDC guidance, every single iteration of the CDC guidance. It says a lot of the similar things that we've been seeing. In the second bullet here, they do have some guidance about individual spaces and practices, like cleaning restrooms and trash is pretty common and pretty sensible, right? Another is on the air conditioning vents. The filters in your air conditioning vents in your office should be cleaned more frequently. Obviously you will want to separate your chairs in your visiting area, your waiting area. You'll want to clean them more than at the end of the day, because people may have their arms on the armrest or be touching the tables, and you will want to have someone come through perhaps twice a day, in fact, to clean those as they're used by other people. Next slide. And you'll know, again, from your individual space, what are the high contact surfaces, including workstations that employees have, the reception area, where do you have your supplies, and if you have a breakout area, as we said before. Next slide. Social distancing is obviously critical. Just talked to Dr. Fauci, and that's been repeated for the past 2 months. Different ways of doing it at different parts of your office, perhaps, but do you mark the floor? Do you have plexiglass at your reception area? That's pretty common in most places these days. Requiring everyone to wear a face covering, your patients, when they come in. Screening patients, we'll talk about temperature in a little bit, but you clearly want to have a protocol in place to determine, not only to advise patients not to come. If they feel sick, they should stay home and reschedule their visit. But if they don't do that and they arrive at your office and they appear to be sick, sneezing, for example, you'll want a protocol to how to deal with that. Do you have a place that you can isolate them if you can't immediately send them home? And we've said before, staggering work hours, staggering patient visit times. You'll want to have signage as much as possible. As much as everyone has heard almost every one of these things constantly for 2 months, we all know from being out in the few places where we go these days that people are not following them. So the more signage you have, the more disinfectant you have available, and hand sanitizer, obviously, will put you in a better position to assure people that you're taking the right and reasonable steps. Next slide. On temperature testing, you may already be doing this. Certainly I've been to the doctor and they were when I had been there in the last 2 weeks. Identifying the specific temperature threshold that you're going to use. If it's 100.4 that the CDC uses, it really should be a black and white. If it's at or above 100.4, you would not let people come in, whether it's an employee or a patient. The record keeping, there are concerns with disability discrimination about whether you maintain records and commingle them with your HR records about medical information, because you don't do that typically with your information about your employees for your health plan, for example. So you wouldn't do that here. If you do keep records, and we've had internal discussions in our practice group, should you record the temperature that people have? Should you just record whether it's a yes or a no, whether they are at or over 100.4 or not? So we advise to do the yes or no route rather than identify a particular temperature. Where I say do not make individual assessments, what I mean there is someone may come in and have 100.5 and they may say, look, I just ran in from the car. My air conditioning wasn't working, but I'm really not sick. I feel fine. I just, give me 10 minutes and I'll be fine. You really, if you're going to take temperature, you should be consistent and not make these individualized assessments and say, okay, well, you can come in. I understand, that's fine. But another person who's at 100.5 cannot. That's where you'll get into potentially difficult areas with respect to how are you selecting who's going to stay and who's going to have to leave, and could there be arguably some discriminatory argument made about why someone was excluded and someone wasn't. On the last point there about limiting the duration, this is obviously, temperature testing is something that Taylor would talk about with the EEOC guidance. You couldn't do before. You couldn't ask some of these questions that we're talking about before, but the EEOC understands that under the COVID environment that we're in, certain questioning to assure the health and safety of your employees is appropriate. But you won't want to do it as a matter of practice for an ongoing basis. You really would try to do it for as limited a period as possible, and for safety reasons only. Next slide, please. PPE, probably don't need to talk to this practitioner group much about PPE, but there are guidelines, obviously, and most of the discussion is about whether PPE is properly fitted and whether it's sufficient supply. We've all seen the stories on the news of people being asked to wear their mask multiple days, even when they see multiple patients and so forth. So that is an issue for your safety and health of your employees, as well as that will be one of the ones I mentioned earlier about a potential liability concern if regular clean PPE is not available. Next slide. Now that's obviously quick, but Taylor's now going to talk about some of the disability issues, and then we'll get into some of the leave issues a little bit later. Taylor?
Thanks. Could you go to the next slide for me? All right. As mentioned earlier, I'm Taylor White. I'm in Foley's Dallas office. Paul just took us through a bunch of great information about having a thorough plan for reopening your practices, make sure you've got good safety measures in place to protect your workers. But there will be instances where you'll be faced with employees who may have their own individualized or particular issues that you can't avoid or address with good safety practices. In those circumstances, there are various considerations for what you can and can't do when dealing with COVID-19 in the workplace and its impact on quote unquote disabilities covered by applicable federal and state laws. So, what is a covered disability? And as healthcare professionals, many of you, if not all of you, are already probably familiar with the general definition of disabilities for purposes of preparing documentation to be provided to employers. But as a quick refresher from the Federal Americans with Disabilities Act perspective, it's having a physical or mental impairment that substantially limits one or more major life activities of such individual, having a record of it, as Paul alluded to earlier, you're keeping records of your temperatures, etc., or being regarded as having one. And that's kind of that's a touchy one in this context, and we'll touch on that a little bit. I think there probably are some questions about it. Now, keep in mind the ADA, the federal ADA, only applies to employers with 15 or more employees. The same is true for the Maryland Fair Employment Practices Act as it relates to disability discrimination and accommodation requirements, 15 or more employees. But other states may have broader applicability to even the smallest employers. Wisconsin, for example, and New York, as of February 8th of this year, apply to any employer with one or more employees. In other words, they apply to all employers in those states. California, Fair Employment and Housing Act, which California boasts is even broader than the federal ADA, applies to employers of 5 or more employees. So you got to be mindful of whatever state you're operating in, that it might have a broader applicability in terms of its state law, or in fact define disability differently or have different requirements. New York and California are prime examples of that. There may be different requirements. Wisconsin's got a clemency and forbearance requirement that may be broader than your typical reasonable accommodation. So you have to be mindful of some of those various requirements. Regardless, under whatever law, ADA, state, whatever, this is a highly factual analysis. Everybody has different needs and life circumstances, medical and otherwise. So you should definitely, I would encourage you to indefinitely involve, your senior managers, HR professionals, employment counsel, if you have it, to help you out with this, with these COVID-19 type of situations. Next slide, please. But what the ADA and most, if not all, of these state laws have in common are 3 basic requirements. You as an employer can't discriminate against someone with a covered disability. You have to accommodate, except where it would be an undue hardship, which we'll talk about here in a little bit. And you may not, very generally speaking, in the context of COVID-19, make certain medical inquiries unless they're job related and consistent with business necessity. Now, we're going to talk about some of those requirements a little further in light of the pandemic. But first, I do want to mention kind of a common disability-related issue that I think a lot of employers are and should be concerned about, that touches on each of these requirements to some extent, and that's employee fear. Right? We're all dealing with unprecedented times right now, and frankly, we're all a little afraid of what's in store for us. But that doesn't necessarily mean we all have a covered disability. And I think, as a very general matter, it's unlikely that fear all by itself is a covered disability under the ADA or similar state laws. But where that fear stems from a pre-existing or an age-related physical impairment like asthma, diabetes, heart conditions, which the CDC says put a person at a higher risk in the COVID-19 world, I mean, that may be a different situation. Or what about whether fear is a manifestation of a mental impairment like generalized anxiety disorder, OCD, PTSD, or the like? If the employer is concerned about the employee's health and well-being jeopardized upon returning to work, the ADA, I would note, doesn't allow the employer just simply exclude the employee or take some other adverse employment action solely because the employee has a disability or potentially a disability that the CDC identifies as potentially placing them at a higher risk if he or she gets COVID-19. But if the employee is concerned and requests an accommodation, these could all very well be covered disabilities that require accommodation, or at least an interactive dialogue about the same. And the EEOC recently said as much in some guidance issued over the last couple of weeks or so. Next slide, please. So let's talk a little bit about what the EEOC has to say about how employers should be dealing with COVID-19 in the workplace in light of the basic requirements: non-discrimination, make accommodations, and only deal with permitted inquiries and examinations. And there are two main sources of the EEOC guidance about in the COVID-19 world. And the first is the EEOC's Pandemic Preparedness in the Workplace and the Americans with Disabilities Act, which it updated on March 21st of this year, right at the outset of all this, specifically to deal with COVID-19. And then there's a second FAQ about what employers should know about COVID-19 and the ADA, which they updated on May 7th, 2020, in light of some recent developments and learning more about symptoms and things like that. Next slide, please. So, you know, and in terms of symptoms, I mean, this is where kind of permitted inquiries comes in, and employers, in terms of inquiries and examinations, which we'll talk about momentarily, and as Paul alluded to earlier, employers have a little bit more option, or a few more options than they used to. But there still are some limitations. First, you can generally ask about COVID-19 symptoms, but not just the ones that the EEOC has formally recognized. According to the EEOC, you should be consulting with the CDC and other public health agencies about emerging symptoms, because these sources may guide you in figuring out, you know, what you want to ask with whether somebody would pose a direct threat. And we'll talk about the direct threat here in a second. Can you require a doctor's note regarding those symptoms? Maybe, kinda, sorta. You can require a doctor's note about the restrictions to make a determination about reasonable accommodations, about what they can and can't do in the workplace as part of the interactive dialogue. You can ask things like how the disability creates a limitation, how the requested accommodation effectively addresses that limitation, etc. And maybe you can require a doctor's note regarding the COVID-19 symptoms in light of the importance of the need of containing the spread, which the EEOC and kind of, I don't know, somewhat of a moment of uncommon clarity seems to recognize. But one thing I'd note is that the potential for employees to fib about their symptoms, I think, kind of comes into play here a little bit. I've dealt with that situation before. Under most circumstances, it's going to be a terminable offense, potentially even a criminal one. I think I read an article recently where there were some potential criminal consequences where an employee fudges a positive test. So I think all of that weighs in favor of allowing you to request a doctor's note to you know, verify the veracity of the same, but you need to have a real good reason before you're requesting a doctor's note about the symptoms. Now, it's a bit of a jump ball. Best practice, if you have a good business reason, you probably feel okay about it, but maybe you don't need it. I think you can take the employee's word for it for the most part. But on the back end, the EEOC has been a little bit more clear. Can you get a fitness to return to work note? And the answer is yes, you absolutely can. As a practical matter, and I bet all of you know this better than most as doctors and healthcare professionals, you guys are very busy, and especially right now, there's a lot of doctors, healthcare professionals very busy dealing with the pandemic outbreak. And so it may be difficult for them to, for an employee to timely get a fitness for duty document. But so just be mindful of that, be flexible in what you're asking for and creative. But at the same time, it's probably a good idea if somebody tests positive to try and get some sort of release before they come back. Now, I will say the EEOC's kind of muddied the water a little bit here. Maybe you can just come right out and ask, do you have COVID-19? Have you had it? The EEOC spends a lot of time telling employers that they can only ask about symptoms and restrictions, but then in the guidance from earlier this month, they say employers may take steps to determine if employees entering the workplace have COVID-19 because an individual with the virus will pose a direct threat to others. So the direct threat analysis is a fun one. We could spend a lot of time talking about it. We won't do that today. I'll spare you from that, but I'll generally say that a direct threat it means a significant risk of substantial harm to the health and safety of the coworkers that can't be reduced by a reasonable accommodation. Basically, if an employee poses a direct threat to himself or others, he's not protected by the ADA's anti-discrimination provisions, that first requirement we talked about. And the EEOC has recognized that COVID-19 probably fits the description for a direct threat. And I'd also point out that it's kind of heightened by the CDC's own recognition that the virus can spread, can be contracted and the individual has no symptoms. So that's an issue that employers are dealing with as well. But again, some of this is clear as mud, but your best practices here again are to run your practice in and make good business judgments, document the business decisions you're making with respect to your employees and why, and follow the guidance from these agencies to avoid trouble. Next slide. So one question a lot of employers are asking right now is whether they can administer their own medical tests and examinations. Yes, you can in general. I won't spend a lot of time on this because Paul talked about it earlier. I tell most of my clients, look, if you can do this stuff, and you guys as doctors' offices and your practices probably can better than most, an alternative to taking temperatures, requiring COVID-19 tests, or if you have a good job-related reason, with the business necessity to do it, some other tests like an oxygen test or something. If you're an alternative to that is getting some sort of disclosure acknowledged by the employee. Hey, look, before I come into work, I'll take my own temperature. If it's 101 or 100.4 at or above, then I'll stay home from work. And you get those disclosures in writing, acknowledged, keep those on file, and that's an alternative that that you can do as well. But again, you can absolutely do some of these tests. Next slide, please. So whether a physical or mental impairment is a covered disability is a highly factual analysis that generally requires an individualized assessment. And I do want to mention this is a little bit, when I use the term individualized assessment, that's a statutory regulatory type term here to determine whether somebody has a disability. It's not the same thing that Paul mentioned earlier. You don't need to make factual determinations on the spot when you're taking temperatures. This applies to somebody if they come to you and they say, look, for example, I'm afraid to come to work because this has got me really scared. I've got generalized anxiety disorder. I'm all out of whack. My meds are off. Okay, you got to do an individualized assessment to see if that type of situation is a covered disability. If it is, you may have an obligation to accommodate that person. So what sorts of accommodations can you do? Well, that of course requires a case-by-case analysis, some flexibility. You have to take some steps. The first of those is a duty to engage in a dialogue with your employees about how you as the employer can help them complete the essential functions of their job. That's called the interactive dialogue. Just like it sounds, it's open, flexible. You got to be a good and understanding listener. Employers are not generally required to provide whatever specific accommodation is being requested if it's an undue hardship, which generally means that it's a significant difficulty or expense to you. If the employee requests something that you can do without an undue hardship, do it. And so what are some of those typical ones? Teleworking, Paul mentioned earlier. A lot of people have been working from home. I suspect some of your workers are going to have a tough time doing that. Your nurses and those sorts of staff that are seeing patients, unless you're doing some sort of telehealth program, probably a lot of you are. But to the extent that your workers can work from home, your admin folks, your accountants, schedulers, whatever, consider allowing them to do that as a while further as a reasonable accommodation if they've got a covered disability. But be sure to appropriately manage it with written requirements and hours, performance expectations, things like that. Another typical accommodation is an extended leave or delayed return to work, and this interplays a little bit with the Families First Coronavirus Response Act. You may have to provide leave if they meet certain qualifying reasons, but consider it as consider paid or unpaid leave as an accommodation as well. PPE is another one. Paul went through a lot of this earlier. I won't go into it again, but you know, one of the things I do want to mention is that some people, let's say if you've got asthma or something like that, that maybe they can't wear a face covering the same way, there maybe have to modifications you have to consider doing, and whether that's, you know, some sort of other administrative control, such as, you know, letting that person work more on their own so they're not all in a face, so they don't have to use a face mask quite as frequently, then that's a good idea. Next slide, please. All right. Unfortunately, we cannot leave the topic of returning to work without talking about paid leave. Next slide. The concept of required paid leave is it's a really highly nuanced, complicated onion to peel. You've got federal statutes, state laws, local ordinances, individual employer policies that all have their own requirements for paid leave. They have their own qualifying reasons, different sequences and timing, amounts and notice requirements and uses allotments and carryover, blah, blah, blah. You got a lot of stuff to deal with, but we're going to focus on the Families First Coronavirus Response Act, the FFCRA, since it's widely applicable to private employers with fewer than 500 employees. Some of you have practices that are pretty small. Consider the small business exemption. Also, there's the healthcare provider exemption. I don't have it on this slide, but frankly, the DOL has encouraged, you know, to be real flexible in electing to use that exemption. I mean, we're going to talk about some of this with the assumption that a lot of you are going to go ahead and provide the leave where you know, where you can. And we'll cover the qualifying reasons for the FFCRA in the next slide. But one thing I do want to mention here is that there are state and local requirements as well. There's a paid leave or paid sick leave movement across the country at both the local and state level. I've put a few up here just to bring this to your attention. Nevada went into effect January 1st of this year. It's impeccable timing. You literally in San Bernardino County, New Mexico goes into effect in a little over a month. Maine goes into effect January 1 of 2021, and those sorts of states. This is kind of the PTO type requirement. You don't have to have a reason for leave at all. If you've got the accrual, if you've got enough leave, you have to get it, and assuming they've provided you appropriate notice. So you got to be mindful of some of those requirements of where you are. Next slide, please. So the FFCRA has two paid sick leave requirements, the Emergency Paid Sick Leave Act and the Emergency Family and Medical Leave Expansion Act. The Paid Sick Leave Act applies to all employees and allows up to 80 hours of paid leave for any 6 qualifying reasons. We'll go through those in a second pretty quickly. The expanded FMLA applies to those employees with at least 30 days of tenure and allows up to 12 weeks of leave, some of which is paid for one qualifying reason. So next slide. So the 6 reasons here, we've got them up here kind of on a chart just for ease of reference. Each has its own paid leave allowances. This chart outlines those reasons rather than going through each one and talking about the nuances with each one. Again, you know, you guys have probably have some sort of exemption you can rely on in a lot of situations, but I do want to talk about at least the first 3 up here that are in red, and that is because they relate to your employees specifically. If they're subject to a quarantine or isolation order related to COVID-19, or they've been advised by a healthcare provider to self-quarantine due to concerns related to COVID-19. And on due to concerns is kind of interesting language. The DOL has explained that that could actually also mean those people who are particularly vulnerable. So if you have somebody who is older, or somebody who has or somebody who's pregnant, or somebody who has heart condition or asthma, something that the CDC has described as putting somebody at high risk, that meets that requirement. So if they go and get a doctor's note, maybe they've got, then they have the qualifying reason that meets this just by virtue of doing that. And then in addition, on top of that, they've got potentially a covered disability that you have to accommodate even once their paid sick leave runs out. So even if you're exercising your exemption as a healthcare provider, you may still have to give them paid leave, or unpaid leave anyway under the ADA under certain circumstances. So it's important to think about these multiple layers as you go through it. The third one is, are they experiencing symptoms and seeking a medical diagnosis? And I think that's kind of the key part here. Are they actually going to go get tested, or if they're just, home, well, I don't feel well, whatever. Well, they should stay home, but if they're not going to go try and get tested and get a diagnosis for COVID-19, they probably aren't going to be qualified to get this. So the other thing I wanted to note, the second deal with some other situations, but I do want to just bring your attention to the rate of pay for the leave. So the first three reasons, the employee gets the regular rate or the applicable minimum wage, whichever is higher, up to, and here's the caps, this provides the employer some protection, $511 a day, or $5,110 in the aggregate. And there's different, it goes down from there for the other ones as well. So, I mean, note, if it's 10 working days, if you're doing the math, essentially is what that equates to. So next slide, please. The expanded FMLA only has one leave or one reason for leave, and that's if the employee is unable to work because he or she is caring for a minor son or daughter whose school has been closed and is unavailable, or the child care provider is unavailable due to COVID-19. It's the same reason as the fifth under the FFCRA's Paid Sick Leave Act, and the DOL intends for them to work together. The expanded FMLA provides pay at 2/3 the employee's regular rate of pay, but only up to $200 a day and $10,000 in the aggregate. So note the employee who qualifies gets both the paid sick leave and the expanded FMLA in that order. So so again, all of this is kind of meant to work together. All right, next slide. And so, how do you navigate all of this? And that is teleworking. The first question you have to ask, at least for FFCRA purposes, can they telework? If so, they don't get paid leave because they can work from home. That's a requirement. Consider teleworking as an accommodation under the ADA. So even, again, even if you're electing some exemption, you've applied for it, you've gotten it, you may still have to give accommodations such as teleworking or unpaid leave as an accommodation. So you have to think through those issues. Does the employee? The second question you need to ask is whether the employee has sufficient paid leave available. They get 80 hours. For full-time employee, that's for the paid sick leave. They get a lot longer from the expanded FMLA, but that time follows the employee. That 80 hours, for example, follows the employee from employer to employer. So if somebody tries to take advantage of that, you should ask them, hey, if it's a new employee, have you used any of your paid sick leave under the FFCRA at a prior employer? So they don't get that full 80 hours with you. Another question, have they given you appropriate notice? This is a really flexible one. I mean, you can allow them to to follow reasonable notice procedures, but only as soon as practical after the first workday or portion thereof that's missed. If they give you oral notice, that's okay, but you make sure you're documenting this stuff in the notice on the back end, right? If they call in and say, hey, my child's school's closed, I can't come in today, you need to make sure you're documenting the reason for that so you can get your tax credit. That's important because that's going to give you guys some additional help on the back end. Lastly, have they provided appropriate information for you to be able to collect all this, to be able to get your tax credit and document it? So they can get their name, you can get the dates of requested leave, the statement that the reason they relied on, a statement that the employee is unable to work or telework due to the reason, and depending on the reason for leave, the name of the healthcare provider who advised the employee to stay home, or the child school or child care provider or something like that. Again, if you get this information, document it, you'll be able to claim and support your claim for a tax credit down the road. But remember, keep in mind that the U.S. Department of Labor has certain limitations on the information you can collect, and the EEOC weighs in on that as well. All right, next slide. Okay. So, look, we're all dealing with, unprecedented issues and risks and liabilities here. This is guidelines and best practices are constantly changing. So, the hope is, use this presentation as a starting point as you create your policies and your practices, but make sure you're working with your senior managers, your HR staff, your employment counsel, if you have it, when you're making these decisions, you're implementing these policies, and make sure you stay abreast of everything new the CDC is saying, your local public health agencies are saying. I'll use an example of some whiplash we've all gotten. OSHA, for example, has gone back and forth 3 times on whether you have to record a COVID-19 illness in the workplace. And the current iteration of what they've said is, yes, you do. You have to make a determination if it's work related, and if it is, you've got to record it on your OSHA log. So, and that's going to be applicable to everybody, all employers, including you guys. So there's a change, and it goes back and forth. They add new symptoms, they discover new stuff. So you got to keep up with all of that on the back end. Take the guidance and advice, even if it's not the law. Try to implement it and do yourself some favors, and always document your business decisions, why you're doing things, why you've made decisions you have, so that you can use that on the back end to show your contemporaneous, legitimate, non-discriminatory business reasons to protect yourself later. All right, next slide.
Okay. Thank you, Paul and Taylor, for that very informative presentation. I want to point out, Taylor, you made points on 2 different slides to take copious notes. And the reason for that is that if the federal government is going to be giving you tax credit capabilities, they can also come back and audit. So that point can't be stressed enough to take good notes on everything you're doing. We do have some time for a few questions. I would like to bring up the first question. A member writes that he has an employee who wants to return to work, but she is older and not in the best of health. He says he has insisted that she discussed returning to work with her primary care physician to provide something in writing before June 1st. Is this a reasonable request based on concerns about her health and susceptibility to exposure to patients and their caregivers?
So that question that touches 2 of the points that we talked about with respect to the ADA. 3 really. The first one is, does she pose a direct threat? And the answer is, she probably doesn't pose a direct threat to herself. To her coworkers, right? Because because she falls into a high risk category. The EEOC has said, just because they're higher risk doesn't mean you can take an adverse employment action against them. Now, requiring them to go get a release before they come back in, doctor's note saying they're in full health, that could be construed as regarding them as disabled under some circumstances. And that's where this kind of gets dicey, right? Like we all want to take care of our employees, and we want them to be healthy and safe, but you have to do so in a way that operates within the bounds of the law. And you're really running a very thin line on whether that's regarding that person as disabled, and if so, have you damaged them in some way? And if you have, then that's, if you're not paying them, or you're saying, look, we're not going to pay you until you come back and you can't come back, then that potentially gives them a claim under the ADA to come after you, or some state level law if the ADA doesn't apply to your business.
Yeah, and this is Paul. Let me just jump in with one other point, because I think the question also was about whether the employee is older, and it doesn't say what age that is, but there's also a potential age discrimination, AGE, age discrimination concern there. If you're making certain assumptions about someone just because of their age. So even if you peel away the part about their health, if you're making decisions, let's say you're either want to not have someone come in because of their age, that person could make a claim that they're being treated differently because of their age and potentially have an age discrimination cause of action.
Oh, thank you. Our second question: if one of my employees becomes ill and tests positive for COVID-19, how long should I tell them to stay home before she can return to work? And do I need to inform my patients or other employees that they may have been exposed?
This is Paul. I'll start with this one first. There certainly is CDC guidance about what period of time and what circumstances under which someone should come back if they've tested positive. So you certainly should follow that guidance. Obviously, if there's someone can be exposed and not test positive, and then there's usually a 14-day quarantine. But if they've tested positive, it will depend on what their symptoms are, but they certainly should stay home so that they don't infect other employees and any of your patients. But it's going to be dependent upon if they test positive and don't show symptoms, or if they do. So it sounds like the question was they became ill and tested positive. So it sounds like there'd be no set time to be out. And our guidance has always been if you do have someone test positive and they have been ill, that it would certainly be a best practice to advise your other employees, and whether you tell patients is different depending on if a patient was exposed to that person who was sick. But other employees, if they were working all day with that person and it turns out they tested positive, that would be sufficient exposure under CDC guidelines to say that this person, that other employee might have to self-quarantine. So you should clearly advise those others who may have been exposed as a best practice.
Yeah, and I'll add to that. I looked at the CDC's current guidelines earlier today, and I think the current thinking is it's like 10 days after your symptom, you've completely recovered from your symptoms. So the answer is, how long do they have to stay home? As Paul mentioned, depends on their symptoms. There's no set amount of time except for this kind of general guidance of 10 days after their symptoms are gone. And then, one tip you guys can do for your employees when you're opening, you can have them sign it's a disclosure statement I mentioned earlier, and that that allows them to go ahead and acknowledge and give you permission to disclose their name, because you want the EEOC says you can do it, says you can tell people, or their coworkers rather, who that they might potentially have been exposed. That's right, but you can get their written and voluntary knowing permission ahead of time to be able to disclose that, and you should. Among many other things, also, you want them to acknowledge that they're going to abide by the safety rules, that everything that Paul outlined earlier. Hey, you got to wash your hands. We expect you to be using hand sanitizer. Wear your PPE. We expect you to do all this. Get their acknowledgement and their sign, among many other things that can go in a disclosure statement ahead of time, and that gives you a little bit of protection on the back end as well in making those disclosures. But I think under all circumstances, I think most local public health agencies are requesting, if not requiring, that information be disclosed to them so that they can then go do their due diligence and track and trace the contacts for them as well.
To that point, with public health agencies, would it be prudent to also inquire with them about any guidance along the same lines that we're talking with these questions?
Right. Yes, sure. Absolutely. Yeah, they may have. Go ahead, Paul.
No, I mean, certainly, because as we've been saying, the guidance changes. And so the most up-to-date guidance, to the extent, you can keep abreast of all of that, that's going to be the best practice for running your practice and protecting your people, because that's the guide, the best set of guidance is usually going to be what the CDC has to say about these types of issues.
Okay, we have time for just one more question. This writer wrote in, I heard that the healthcare providers are exempted from the expanded FMLA rules. Is this true? And are there any legal concerns if I do not provide childcare related leave?
Well, Taylor, I think you talked about that a little bit already in your one of the slides, but do you want to take that one?
Yeah, so the answer is yes. You do have, there is an exemption that you have in the FFCRA, but what is a healthcare provider? And it's pretty broad. It's the EEOC has said it's anyone, excuse me, the DOL has said it's anyone employed at any doctor's office, hospital, healthcare center, et cetera. I would imagine that applies to most of your practices. But the Department of Labor has encouraged employers to be judicious. That's the word they use when using the definition. You may decide, okay, yeah, your employees are exempt under this the healthcare provider exemption, but we're going to go ahead and give you paid sick leave anyway. Why? Because we want to do our part to flatten the curve. We want to take care of our employees. We want to let them take care of their families, things like that. Think about that. Think about also, hey, is this is there something, some part of their job that they can do from home? So even if you are taking advantage of, the exemption, do you have a PTO policy that you can extend to them? Do you have other types of leave that may be available? Can you accommodate them in some way and work with them? I think that's what the DOL would. That's what they kind of mean when they talk about that. So you do have one, but the DOL wants you to be flexible with it.
Terrific. Okay, gentlemen, that's all we have time for tonight's presentation. I want to thank Paul and Taylor for their presentation, and I want to thank our listeners for your membership. And please do not hesitate to reach out to me or to any member of the APMA Board of Trustees or staff. We can be of any assistance to you in the future. Thank you, everyone. Have a great night.
Thank you.